Good morning, and welcome to this 2023 Spring Medicaid Fair, your first session with CareSource Healthcare with Heart. My name is Tara White, Senior Director of Population Health, and I will be presenting with Becky Katzowitz, Senior Director of Network Performance and Engagement. A few friendly reminders before we get started. We invite your questions during this session. Please post them in the Q&A function that is in the Teams format. If by chance you don't have chat or Q&A, we will invite you to raise your hand at the end of the Q&A session that we may respond to your question. A few notes. This presentation is already posted on GAMIS under provider notices. This session is being recorded and will be posted on May 1st, and they will compile all questions and answers and post them on May 1st under provider notices. With that, let's begin. Our first session will be member engagement. Our focus areas will be how we remove barriers to care with maternal health, behavioral health, and in rural communities, how we're incentivizing our members under 21 to return to in office visits and promote immunizations. What does telehealth look like post pandemic? And our member redetermination strategy. At CareSource, we've launched Mom and Baby Beginnings as our maternal access to care program. Mom and Baby Beginnings focuses on maternal and infant health. It's an integrated social and clinical support program. Our care managers and our community health workers ensure that our pregnant moms who are participating have access to the appropriate providers for their care. We ensure access to any value added benefits, wellness programs, incentive programs, and we've developed community and retail partnerships to support our pregnant moms. We partner with Open Hand Atlanta to provide nutrition education with the registered dietitian, online support classes, and a support group. We also launched a retail partnership with Walmart and Johnson & Johnson to support maternal health. Through the partnership with Walmart, we provide high-touch pregnancy care. Our members are incentivized for completing their healthy behaviors, and there's some healthcare provider education. Also, with the partnership with Walmart and Johnson & Johnson, we have Georgia Mama Care. Georgia Mama Care is a new pregnancy program for CareSource members, but all pregnant moms. Through this program, members have access to a digital platform, Baby Live Advice. Baby Live Advice connects pregnant women to doulas, nurses, midwives, nurse practitioners, lactation consultants, and nutritionists. They also have an option to connect to their primary provider in support of their maternal journey. Please visit georgiamamacare.com for more information, as we'd love to get our CareSource members as well as all pregnant moms connected to Baby Live Advice. For behavioral health, we have a complex member strategy. To begin, we launched CareSource Stronger Together. CareSource Stronger Together is a program that supports high risk members with behavioral health issues and their families to community resources, value added benefits, and intensive case management. We're launching an autism pilot. The pilot is designed to increase family involvement, increase early detection, screening, and intervention, and ensure appropriate quality of care. For suicide, we have an initiative to provide support and an enhanced benefit to our high-risk members who have experienced suicidal ideation and or behavior. For first episode psychosis, we have an initiative to support our younger members experiencing psychotic symptoms. And for trauma informed care, movement to ensure we operate as a trauma informed organization by providing specialized training to all staff. What does Teledoc? What is telehealth support? We offer Teledoc. Teledoc is a 24/7 support line where your PCPs do not have access to telehealth or have set hours. Teledoc provides access to board certified providers who can assist with common health problems and behavioral health care. Teledoc can be accessed via website. There's a 1-800 number and there's a connection to the mobile app. Our CareSource 24 line. provides referrals to Teledoc where additional support may be needed. For our members under 21 and for those in rural communities, we began bringing access to the community. At CareSource, we provide access and believe that equity and access and community resources are important to our members. So we partner with providers to drive member engagement around well visits and immunizations. We partner with a few rural providers to provide family initiatives and whole family care days where kids could go to their primary doctor and do their in office visits. We've partnered with mobile units and local community organizations to provide services like well checks and health screenings in the communities where our members live because we understand that sometimes transportation is a challenge. For example, we partnered at the Dream Center Church in Atlanta. And every other month, we bring the mobile unit and connect whole families, not just to their providers, but support their social determinant needs. We've partnered with the Atlanta Hawks and the College Park Skyhawks to promote our youth wellness campaign. Don't miss a free throw, don't miss a well check. It provides wellness information and education to our children and their families through sports related activities. And it also gives our families an opportunity to be encouraged to go back to those doctor's visits. We've partnered with Walmart to promote Baby Days Plus CareSource. Baby Days Plus CareSource connects our new and expected moms to doulas, community resources, Georgia Mama Care, and other information that can help them with a healthy and successful pregnancy journey and pregnancy delivery. We had our first baby days in March, where over 1,200 people in the community in Riverdale and Decatur were connected to 9 community partners. We distributed over 200 books. There were 10 education sessions and tons of information and resources about prenatal postpartum visits, well visits, and immunizations. We offered Teen Smile. Teen Smile was a community event where we partnered with volunteer dental professionals to provide dental services and preventative screenings, where over 300 people in the community were connected to dental services. And we partnered with the University of Georgia for sports camps for youth wellness and education. Through those youth sports camps, we promoted well visits, health screenings, and education for our kids. We continue to incentivize healthy behaviors through our three incentive programs: Babies First, Kids First, and My Health. Babies First covers our pregnant members, youth, and adults, and our babies through 15 months. The program incentivizes prenatal, postpartum visits, and well baby visits and health screenings. For Kids First, it covers our youth 16 months through 17 years. It incentivizes well and dental visits, immunizations, and health screenings. And for My Health, it covers our adults 18 and over, and it incentivizes well and dental visits, immunizations, and health screenings. And finally, for our member redetermination strategy, how are we at CareSource helping our members stay covered with their Medicaid? To begin, we have the IVR. Redetermination and address updates, reminders, and messages will play at the onset of each call and during the whole time for all calls. For those received in member services at our toll free line, the member portal. The redetermination process and information is posted on the member portal for easy member access. Call center incoming calls. During every incoming call, the call center representatives verify the up and update member addresses, remind our members to check their mail for their renewal letters, and encourage our members to renew their health care benefits. Call center member outreach. Every month, each member with a renewal date for that month will receive a reminder phone call to renew their Medicaid benefits. We'll leverage text messages and emails to connect to our members. Each month, text messages and emails titled, "Did you check your email?" based on their communication preferences will be sent to members, reminding them to renew their benefits. We've also added a redetermination insert that will be included in all member mailings, including a request for the member handbook. For provider education, the redetermination information and reminders for providers to educate and remind members about renewing their benefits will be posted on our provider portal. Our health partners will continue to educate providers during those regular provider visits and share redetermination packets. And we have frequently asked questions that will be posted on the provider portal and shared during provider visits. For our higher volume providers, each month, providers with the highest volumes of renewal members for that month will receive a visit from their health partner who will educate the provider and share the collateral materials. Our community marketing representatives will also be stationed in those provider offices throughout the month to educate and inform members about the redetermination process and to capture addresses where we can. We are planning for discussions with larger health systems and facilities to help facilitate and support this member education. We've developed some community partnerships to support this effort. We will have CareSource redetermination banners and signage placed at various locations throughout the state that will contain renewal reminders and instructions about how to access information about their benefits. Our member encounters and our face to face engagements. Our care management team will educate and remind our members who are in our programs with care management. Our life services life coaches will educate members who are requesting services and who are enrolled in our life services program, and our community marketing representatives who are in the field and in the community will provide education and information to remind our members about redetermination at various community events. We will post on social media information about staying connected and reminders to update their information for redetermination. And then finally, referrals. Members who have been deemed ineligible each month will be referred to our internal sales team for more information about alternative healthcare options. At CareSource, we are committed to access resources, equity, and services for our members and the community at large. And with that, it concludes our member engagement program, and we will turn it over to Becky Katzowitz, our Senior Director for Network Performance and Engagement, to discuss provider engagement.
Good morning. I'm Becky Katzowitz, the Senior Director of Network Performance and Engagement at CareSource. For the next few minutes, I'll be discussing our provider network, incentive programs, and resources available to all Medicaid providers. Strengthening our provider network is a big focus at CareSource. Our first step has been adjusting our point of view to focus on the whole health of Georgia by not just focusing on disease management, but improving care for all aspects of our members' lives and the communities we serve. We are in the community, meeting with our providers and talking with them about their barriers and challenges, and finding ways that we can adapt to partner with our providers and ease their administrative burdens. In addition to recruiting new providers, especially in the behavioral health space, we also think it's equally, if not more important, to maintain our current providers and improve the quality of service we offer to providers and keep them happy. This includes reducing or eliminating prior authorizations required for most behavioral health services and optimizing operational processes to ensure quick and accurate claims payments. We are meeting with psychiatric residential treatment facilities, PRTFs, monthly to discuss discharge plans and resources needed for our members to transition home safely. We are addressing healthcare disparities throughout Georgia with care management and life services that go beyond traditional definitions of health. CareSource formed a provider education and resource team to provide training and necessary resources to all of our providers. We are contracted with all major behavioral health systems, CSBs, and PRTFs in the state, as well as a large portion of community organizations and outpatient therapy providers. The current gaps we are finding is access and availability, as well as timely appointments due to lack of providers in some areas of the state. We are partnering with providers throughout the state to create innovative programs to address these issues and allow our members to be seen quicker, as well as working with telehealth providers for necessary services. To strengthen our provider network, we've also significantly altered and improved our value-based incentive programs in 2022 and 2023. These changes led to twice as many members seeing a PCP or a pediatrician. We doubled our incentive payments in 2021 and 2022. And these improved value-based reimbursement programs resulted in a 44% increase in well-child visits and 10% increase in dental visits in 2022. We have provider incentive programs available to all professional providers. As you can see on the slide, we have programs available for PCPs, pediatricians, internal medicine providers, OBGYNs, behavioral health and mental health providers, dental providers, health systems, hospitals, and FQHCs, telehealth, as well as CSBs. We have a large array of incentive programs created to use based on a provider group's member size and partnership opportunities. These programs range from our Quality Enhancer program, which is paid at the claim level and available to all in-network providers, to our gain sharing VBR programs, and many in between. The measures on these programs encompass HEDIS and non-HEDIS measures to incentivize the whole health of our members. This includes health equity and SDOH being addressed. We are excited to offer training opportunities for CareSource providers to learn about the incentive programs and have the opportunity to ask questions. Our provider training and resource team will be hosting several training sessions for our providers. The first session on May 2nd will be only for providers enrolled in our dual Quality Rewards and Quality Enhancer program. If they have not yet, your health partner representative will be reaching out to you to send you a link for this session. The session on May 7th will be for groups who are not enrolled in any contracted incentive program to learn more about our Quality Enhancer program. Please reach out to your health partner rep or contact the customer care line for login information. Our largest provider groups and those in specialized programs will be receiving individual training sessions as well. If you have any questions about anything you have heard this morning, please reach out to your health partner rep who is listed above, listed in the slide. CareSource has an amazing team of health partner network managers who actually all live in the regions they serve, which allows them to be active in the community and really get to know their providers. The amount of focus for each provider group is decided based on the number of CareSource members they serve. Our high volume providers will meet with their health partner representative monthly. Medium volume providers will typically have meetings quarterly, and low volume providers are best served with our customer care line. However, you are still welcome to reach out to your health partner at any time if needed. Our health partners have done a phenomenal job partnering with our providers and the community. For example, in 2022, they planned and hosted various events throughout the state to focus on things like closing well-child visits and immunization gaps, completing breast cancer screenings, prenatal and postpartum events, back to school supply giveaways, and so much more. In fact, we hosted many CareSource days throughout the state where we provided members gift certificates, gift cards for coming in to complete their well child visit, as well as providing incentives for the providers for completing these visits. We had cotton candy and shaved ice. We had blow up machines that you could play basketball, jumping machines. We had a lot going on. They were great fun events for the communities in which they occurred. And we are excited to partner with our providers throughout 2023 as well. Please reach out to your health partner representative if you have any partnership opportunities or if you need any assistance. We will now turn the microphone over to Cheryl Ann Murray, our VP of Operations, to review questions that may have come in through the chat, as well as questions that were sent in with your registration.
Good morning. Prior to the Medicaid Fair, we received a list of questions which had provided specific information and questions on there, and we have already responded to the majority of those provided specific questions. However, some of the questions that were general in nature, I'm going to read those questions today and provide a response, and then address the questions listed in the Q&A room or box. So the first question is, how am I assigned a provider relations rep, and when and how will they contact me? As Becky just recently outlined, health partner managers are assigned by territory. And the territory map was just recently shared. Your health partner will contact the specific person who sent this message for further information. Second question, how does the credentialing for CMO flow over from CBO to CareSource and the time frame to be in network with CareSource CMO? Once the provider is enrolled through the CBO, the provider or practitioner's information is sent to CareSource via a 7400 file. CareSource will add that provider to the existing contract to become participating. This process may take up to 45 business days from the date of the Georgia Medicaid welcome letter. Next question, how to set up online provider portal and how to submit PA. Once you receive your welcome letter, you'll be given a CareSource ID. At that point, you need to go to caresource.com and create a login. You will need your CareSource ID to set up the login process. The preferred method for submission of prior authorization requests is through the use of DCH's centralized prior authorization portal. This feature allows submission of prior authorization requests through a centralized source, which is GAMIS. For questions related to prior authorizations for healthcare services, you can contact the CareSource Medical Management Department by phone, fax, or mail. I would like to ask if there are any upcoming changes for outpatient authorization processes. CareSource evaluates prior authorization requests based on medical necessity, medical appropriateness, and benefit limits. CareSource posts updates through network notification on the updates and announcements page on the provider portal. Please check this webpage often to stay current with all updates. For questions related to prior authorization for healthcare services, you can contact the CareSource Medical Department by phone, fax, or mail. Is the value-based reimbursement program still active? And if so, what are the current modifiers to use? Yes, there is a quality enhancer program for 2023 posted on CareSource website under updates and announcements for providers with the current measures and modifiers. If you have any questions, please reach out to your health partner. What's the process on claims follow-up? For claims questions such as why a claim denied, please contact the CareSource provider call center for assistance. The phone representatives can provide immediate feedback on next steps for claims resolution. If you do not agree with how a claim was processed or reimbursed, you may follow the claims appeal process, which includes the submission of supporting documentation such as medical records to help substantiate the reprocessing of the claim. Once received, all documentation will be reviewed and a resolution will be determined. If these processes still do not work for you, please contact your CareSource health partner for further assistance. Similarly, the answer to the previous question applies to this question as well. Who should the school system contact for help for originating site claims? For claims questions, contact the CareSource provider call center, and then you also have the ability to appeal if you disagree with the resolution. We are a PCP. If a member is pregnant, can we see them? If the services being rendered is within the provider's scope of practice, then yes, you can see the member and CareSource will consider the claim based on medical necessity. What is the best way to update provider information with CareSource? We have changed with GAMIS web portal, but nothing is changing at CareSource. All providers, practitioners are required to update their information via GAMIS. Once this information is updated in GAMIS, it will be sent over on the 7400 file. If this is not happening, please contact your health partner with specific information and he or she will be able to assist. And the last question is, was Walgreens in network with CareSource in November 2022? No, Walgreens was not in the CareSource Medicaid network in 2022. In the Q&A section online, the question is there a separate provider for DME for the CMO? We only get case rate, but have DME supplied by our urgent care offices. The response is yes, we do have contracted DME providers. You can speak to your health partner manager to discuss your current contract. Question, how do I find out who my health partner rep is? You share your information, or you may call 855-202-1058 to inquire about your health partner manager. They're assigned by territory. The same person responded, I'm from a home office that services many different clinics in many different counties. The presentation is posted on the GAMIS website, so the map that was at the end of the presentation can help to identify who your health partner rep is for all the different locations. Are there any other questions? I think at this time, we're allowing, if I'm not mistaken, individuals to raise your hands if you have additional questions. I think there's a question, can't see. Becky, I think you said you're going to be able to handle that because I can't see who's asking questions.
Absolutely. I'll just take one moment. Okay, the first hand that is raised is for Anisha Jones, and we're working on unmuting, so it may just take a moment. All right, Anisha, you should be able to unmute and ask your question.
Good morning. I don't know if you can answer this question, but I thought I'd throw it out there. So I'm calling as a provider from a nursing home, and the dilemma I'm seeing when I have we have residents that come into the facility for CareSource or Peach State like Medicaid programs. They come into the facility for rehab, but what's happening is if they have to transition to long-term care, we would file a Medicaid application to change their program over to like a nursing home class of assistance. But what's been happening to me is when the caseworker goes in the process their claim, it retroactive from the time that they admitted the facility. So it's terminating the CareSource plan. And when I call CareSource because money is being recouped from us, they'll say that's a defects issue. When I call defects, they're not understanding like it seems like I feel like I'm caught in the middle where I can't get both parties kind of understand. So I'm just wondering, on a standpoint as a provider, is it something I should be doing differently so that don't happen? Because like the whole point of the CareSource or P State is because it's an insurance it's a managed product that pays for rehab. And Medicaid doesn't. So if they come off their rehab and can't go back in the community, that's when we file an application. But it's taking out that um, the insurance. It's terminating that policy. And I was just wondering, is there something I should do anything differently so that it don't happen?
Ms. Jones, I think we can have a health partner contact you to
Okay.
discuss the full process, to help you through that process.
Okay.
And Ms. Jones, where are you located?
I'm located, I got several facilities. So the facility I was having an issue with was, oh gosh, which one was it? It was in Carrollton, Carrollton, Georgia. That was the facility I was having an issue with.
Okay, so your health partner representative will be Edwina. And if you go to the GAMIS website where this presentation is posted, you can actually get her contact information and she can help you.
Okay. Thank you.
You're welcome. All right, the next is Leanne. Leanne, we're working to enable your mic. You should be able to unmute now and ask your question.
Unmuting. There you go. Are you able to reshare the territory map
We sure
or
can.
tell me where to find it on the website?
Absolutely. It is posted, this presentation is posted on the GAMIS website at www.mmis.georgia.gov, and it's under Provider Education, Provider Notices. Provider Information, Provider Notices. You're welcome. All right, I see Misty Jeans. Misty, you can unmute. Misty, are you able to unmute? All right. We'll move on to Patty Ravizzo. Sure I say that wrong. Patty, you should be able to unmute. Patty, are you able to unmute?
Okay, I think I figured it out. Can you hear me?
We can hear you.
Okay, I couldn't figure that one out. I just put questions out on the Q&A area, and I had asked them during registration, but I don't remember hearing them being answered now. But we were wanting to know, with the expiration of the public health emergency, will providers be able to continue to provide teletherapy from their home, or will they need to be in the office to provide teletherapy? And then also wanted to ask a question about, sometimes it can be a little challenging to get PCPs to send referrals and sign plans of care back in a timely manner. And for the services that we provide, usually it's an ENT doctor that has referred a patient to us. And can we use the specialist of an ENT doctor to sign the paperwork, send all the documents that we need, rather than the PCP if we're having problems getting a quick turnaround?
Those are great questions. For the first question regarding telehealth, that would actually have to come from DCH. So we will have somebody, see if somebody from DCH can answer that. As for your second question, if you would like to reach out to your health partner representative, they can help and ensure that everything is correct and that you're able to have a solution. So I would reach out to the health partner representative.
Alrighty, thank you.
You're welcome. All right, I'll check back with Misty to see if you're able to unmute. Okay, we'll move on to Angelia Kingsbury. You should be able to unmute. Try it one more time. Oh, I keep seeing yours unmuting.
Uh-oh.
There you are. We can hear you.
Oh, hey, good morning. I was wondering if you guys could repeat that 800 number again, for the provider relations line or customer service line.
We
I think
absolutely.
it started with 855 and then she went so fast I couldn't get the rest.
I
Sure.
apologize. It's 855-202-1058. 855-202-1058.
Thank you.
You're welcome.
I see Leanne. I'm not sure if your hand is still raised or if you have another question. All right. Misty Jeans.
Are you there?
Oh, yes. Hi, Leanne.
Hey, I'm sorry. It was taking a minute to unmute. I have a question. If I have a patient that has AmeriGroup, Medicaid, and they switch to CareSource in the beginning of the month, and I have an authorization with Medicaid or AmeriGroup, and they switch to CareSource, will CareSource backdate the authorization to the first if they change insurance in the middle of the month?
Sherilyn, are you able to unmute?
Can you repeat that question, please? I missed. I was trying to find.
Can you hear me?
Yeah, can you repeat your question, please?
So if I have a patient, I check eligibility every month, the first. And so if I have a patient that switches in the middle of the month to a different insurance, like CareSource, and they had Medicaid or AmeriGroup, will you honor that existing authorization that I have with a different insurance to like retro CareSource authorization to the first of the month?
Yes, I do believe if we've authorized services, or if another CMO has authorized services and a member transfers over to our CMO, yes, I do believe we do honor that authorization.
Okay, thank you.
But
Do I just call CareSource and tell them that the patient switched in the middle of the month and I had existing off with a different insurance and they should fix it?
that would help. That would help
Okay.
when the point comes in. Yeah.
Okay. I'm just starting to see it happen more often lately. Kids switch in the middle of the month and we don't know. So, but thank you for answering my question.
You're welcome.
And Leanne, just to add one more thing, the authorization will be honored for 30 days. So if it's beyond the 30 days, it likely will need another authorization, but we'll also maintain the continuity of care. So you can reach out to CareSource when that happens.
Okay. Thank you.
Welcome. All right, Deanna Jones. You should be able to unmute now.
Hi, can you hear me?
We can.
Hi, just a quick question. Do the health partners can they answer coding questions?
They would be the great person to reach out to. And if they don't have the answer, they'll work internally within CareSource to get the answer for you.
Perfect, thank you.
You're welcome. Great. Leanne, I see your hand is up. I'm not sure if it's still up or if you have another question. You should be able to unmute. Oh, okay, your hand is down. I believe there's no more. Are there any other questions? Deanna, did you have another question or is your hand?
Sorry, I need to take that off.
Okay, not a problem. Rowena Joyner? You can unmute.
Hi, can you hear me okay?
We can.
Good morning. Can you repeat your answer for who to contact if we have coding related questions?
Sure, I would reach out to your health partner representative and they can, if they know the answer, they can provide it or they can ask internally. You also can call the customer care line and they also are able to get the question answered for you.
And when you stated customer care line, is that just our provider service number that we call in on?
That's the 855 number that Cheryl-Ann just read over, and it's actually in the Q&A, but I can give it to you again if you'd like. It's 855-202-1058.
And the reason I ask this is that in the past, if I question a coding issue, my response is usually, I'm not allowed to tell you how to code. However, we're kind of butting heads on what we're finding to send in as correct. And then you guys are sending it back that it isn't. And our coding department can't really determine why it isn't. So would would customer care or the health partner be able to assist me in that way?
We could take specific examples offline if you'd like, if you want to reach out to the health partner rep. We are not allowed to actually direct on how to bill. We cannot advise on how to bill, but we can ensure that the right area is involved and try to help you where we can. So if you want to send over specific examples, we are happy to help.
Thank you so much. Enjoy the rest of your day.
Thank you too.
Thank you.
All right, next I see Christine. Christine, you should be able to unmute.
Hello, are you hearing me?
We can hear you.
Okay, I just had a question. I wanted to know when I'm going to the CareSource portal, is it usually very accurate as far as if the member's eligible or ineligible?
Through the CareSource portal or through the GAMIS portal?
Both, because sometimes I have to check the other side if I don't see the member's information on the GAMIS.
So our website is updated. Oh, Cheryl, I think you're about to answer the same thing, so I'll let Cheryl-Ann answer if you'd like.
Yes, the information, once we receive the information, our websites are updated with what we receive from through GAMIS from DCH. So that's updated very timely. So the information is as accurate as we receive it.
Okay, that's all I needed. Thank you so much.
Thank you. Right, the next one I see is Misty Jeans. You should be able to unmute. see her hand went down. Are there any other questions? If you have, Susan Green. We are working to get you unmuted. Okay, Susan Green, you should be able to unmute. Susan, are you able to unmute?
Yes, I'm sorry. We're seeing a problem with Major Medical not showing for the patient on Gamma's website where we normally check eligibility. But then for some reason on your website, you're showing that the patient has other insurance. So we're getting a lot of denials for that. Are you seeing that to be an issue? Do you know why it wouldn't show up on Gamma's and it shows up on your site?
I would say as you have any of those instances come up, please reach out to the health partner so that we can take a look with you, because that's not an issue that we typically see. So we would be happy to help and figure out what is going on.
Okay, thank you.
You're welcome. Misty Jeans, try again. You should be able to unmute. And Misty, if you're having trouble, if you'd like to post a question in the Q&A, we'll look for it there as well. All right. Susan Green, I see your hand is still up. Did you have another question?
No, ma'am. Thank you.
Okay. We'll try one more time. Are there any other questions for anybody that you'd like to raise your hand? And Misty, I can tell that you're having trouble. So if you'd like to reach out to your health partner to ask any question, we can make sure we get an answer for you. Just going to check and see if there's any other questions came in the Q&A. Chillin, there's a few that look like they came in. Would you like to through those?
I think the Gamma's question was just answered, was just asked and answered. And Carolyn Pereira, where do we send questions for claims? You can feel free to call that 855 number and have the discussion with the provider call center regarding the specific questions regarding your claims. And then, as previously mentioned, if that is not acceptable, then you have the opportunity to appeal the claims. But once you call the provider call center, they should be able to help you. And I don't, let's see, are there any new questions? Is there a way to status outlier payment, or do we have to get the status via our CareSource rep? I'm not sure I understand status. A status on outlier payments, is that what you're saying, Claudine? Is there a way to get a status of outlier payments, or do we have to get the status via our CareSource rep? You can call for claims questions. You can call that provider call center, and they should be able to provide the information for you or help you through the process. I think those are all the questions in the Q&A. Are there any other questions? The health partner map in the meeting is not legible. It is very fuzzy. Becky, if I'm not mistaken, that map is also located on the provider portal. Is that another way for providers to access the information?
It is. It is in the provider portal. It is also in network notifications on our website. And I'll work with GAMUS to see if we can send them. Yeah, we'll send them a new one today so they can post it where these presentations are posted. So you'll have another copy of it. Well, we thank you all for your time today. Please feel free to reach out to us if you have any questions. We enjoy working with you all, and we appreciate all of the hard work that you do working with the Medicaid members and specifically our CareSource members. We, as Tara said at the beginning, we are Healthcare with Heart, and we are here to partner with you and improve care, the quality of care for all of our members throughout the state of Georgia. Thank you again for your time this morning, and please don't hesitate to reach out with any further questions.